Hi. Okay. Let's start with hematological diseases of blood and blood forming organs. Okay. Now, first is disease involving RBCs. Okay. First is anemia, abnormal decrease in number of circulating RBCs plus quantity of hemoglobin and volume of RBCs in a given unit of blood. Okay, is decreased. Oral manifestations are, which is important, general oral manifestations are paleness of oral mucosa, most commonly ventral surface of the tongue, atrophy of epithelium, atrophy of epithelium, generalized atrophy of epithelium. Okay, atrophy of papillae, tongue, glossitis, glistening surface, increased sensitivity. Atrophy of papillae, tongue, generalized atrophy of epithelium, glistening surface, increased sensitivity. Okay, glistening surface and increased sensitivity of the tongue. Increased incidence of aphthous like ulcers, increased incidence of candidiasis, angular cheilitis, denture intolerance, most commonly in females, and glossopyrosis, burning mouth syndrome. Okay. Mm, Bacterial and fungal etiology. Okay, of candidiasis. Now second is, first we have seen the common picture of anemia, and then now it's iron deficiency anemia. Manifestation of iron deficiency anemia is Plummer-Wilson syndrome or Patterson-Kelly syndrome. Okay, discovered by two scientists, Plummer and Wilson. It's a triad of three things: iron deficiency anemia, dysphagia, which is also esophageal, because due to esophageal webs and structures, epithelium is atrophied, and third is esophageal webs. Second, dysphagia is potentially malignant esophageal, in which potentially malignant disorders, Plummer-Wilson syndrome, due to dysphagia. Okay, so this is the pictures, so we can remember it. Triad: Plummer-Wilson syndrome, beefy red tongue, okay, of oral cavity, potentially malignant disorder, beefy red tongue, esophageal webs, and iron deficiency anemia, dysphagia due to esophageal webs, and angular stomatitis. Okay, that's it. Now generalized findings are fever, malaise, weakness, fatigue, breathlessness. Okay, lemon tinted pallor of skin, lemon tinted pallor of skin, also seen with oral mucosa, coiloonchia, concave shaped, spoon shaped or concave nails. Okay, atrophy, contrary to congenital congenital syphilis, parrot beak shaped nails, convex nails. Okay, um atrophy of papillae, glistening surface, smooth surface. Okay, lemon tinted pallor of skin, also seen in oral mucosa. Okay, xerostomia is also present, recurrent aphthous stomatitis, and increased incidence of candidiasis is also present, are also the findings. Okay, now megaloblastic anemia, generalized term. Megaloblastic anemia is a generalized term for erythropoiesis of RBC. Sorry, obviously erythropoiesis is of RBC, which means RBC formation. Two important factors are required for maturation of RBC: folic acid and vitamin B12. If decrease in either of these, if deficiency of either of the two, immature RBCs or large in size, or some nuclear content nuclear remnants are present, complete nucleus may also seen. Okay, because in RBC it is unnucleated or non-nucleated cell. So if nucleus is present in RBC, it means it is immature. Okay, mega means large, blast means immature. Megaloblastic. Mega means large and blast means immature. most important components: decrease in vitamin B12 extrinsic factor, which is also called as pernicious anemia, Burmer's anemia, Addison's anemia, Addisonian anemia, which is an autoimmune disease, destruction of parietal cells, unknown reason, decrease intrinsic factor, so decrease extrinsic factor, which is B12. Intrinsic factor is R, but destruction due to destruction of parietal cells, intrinsic factor will decrease, and so the extrinsic factor. So it is an autoimmune disease. Okay, these three are autoimmune disease: pernicious anemia, Burmer's disease, and Addisonian anemia. But megaloblastic anemia is not an autoimmune disease. It is due to the deficiency of either folic acid or B12 or both. Okay, now B12, which is decrease in B12, which is extrinsic factor, but for absorption its absorption, intrinsic factor is required, which is released by gastric mucosa parietal cell. So that's it. Diet. So it is really necessary for the which is released by gastric mucosa parietal cell. So if destruction of parietal cells occur, then B12 deficiency occur, and in that case we cannot do anything because there is decrease of parietal cells, so decrease of intrinsic factor and then decrease of extrinsic factor. But if decrease of folic acid and B12, two reasons for B12 deficiency: absence of intrinsic factor or decrease in diet. Extrinसिक factor is decreased in diet, यानी विटामिन B12 का intake ही कम है in diet, and destruction of parietal cells, so intrinsic factor is not present. Okay, diagnostic, and which is very severe, intrinsic factor wali, because in that case we cannot do anything, but in diet we can intake. Diagnostic test to differentiate the etiology: Schilling test between pernicious anemia and decrease in vitamin B12 deficiency. Okay, oral manifestations: Schilling test will differentiate between pernicious anemia and vitamin B12 deficiency. Okay, now oral manifestations: atrophy of filiform papillae, glistening and smooth the tongue. Okay, 3 G's: glossitis, glossopyrosis, and glossodynia, painful tongue. Beefy red in color, Hunter's glossitis or Muller's glossitis. Okay, angular cheilitis, aphthous ulcer, increase candidiasis incidence and increase in nature intolerance. Okay, now histopathology is immature large size and poikilocytosis, different shapes of cells. Immature RBC, large size RBC, and poikilocytosis, different shaped RBCs, teardrop shaped RBCs are present. Example. Okay, like this. Now, megaloblastic anemia is completed. Iron deficiency anemia is also completed. Now, aplastic anemia, also associated with Fanconi syndrome or anemia. It is very rare, and Fanconi's generalized olive brown color pigmentation is seen. Olive brown color pigmentation is seen here. Plus, in case of Fanconi syndrome, generalized olive brown color pigmentation is seen, plus aplastic anemia is present. Okay, in case of Fanconi syndrome, and aplastic anemia is a component of Fanconi syndrome. Okay, plus olive brown color pigmentation, generalized. Aplastic anemia is generalized lack of bone marrow activity. Aplastic anemia is generalized lack of bone marrow activity. Okay, etiology: known secondary, better prognosis; unknown primary. If the etiology is known, it is secondary, which has obviously better prognosis because its etio is known, and if it is not unknown, then it's primary, called the primary aplastic anemia, and it has poor prognosis. Okay, oral manifestations are pancytopenia, decrease RBC, decrease WBC, and decrease platelets. Then we have due to anemia, leukocytopenia, thrombocytopenia will be observed, है ना. And then in RBC, in case of decreased RBC, oral manifestation of anemia like paleness and angular cheilitis. In case of decreased WBC, increased infections, increased herpetic infections, recurrent aphthostomatitis, candidiasis, delayed wound healing. And in case of platelets, petechiae, gingival hemorrhages, and periodontitis are seen. Okay. Now, empty bone marrow picture. All cell precursors are decreased except lymphocytes. Empty bone marrow picture, like empty bone marrow picture, all cell precursors are decreased except lymphocytes. The reason why these are spared are not clear. Means hypocellular basement membrane, like bone marrow. Hypocellular bone marrow means the all cell precursors in the bone marrow, because all blood cells are formed in bone marrow only, but except lymphocytes, means lymphocytes precursors are present here, but not all, not rest of the all. Now, thalassemia. So we have seen it has manifestations like pancytopenia, and then all associated with Fanconi syndrome. Generalized lack of bone marrow activity. Okay, secondary is known and primary is unknown. Metaprognosis, post prognosis. And now, thalassemia. It is also called as Mediterranean disease or erythroblastic anemia or Cooley's anemia. Beta thalassemia major is called as Cooley's anemia. Etiology is due to abnormal globin chains. Due to abnormal globin chains, hemoglobin 2 alpha and 2 beta chain are present in hemoglobin. For 2 alpha, 4 functional copies of alpha globulin gene located on chromosome 16. 4 functional copies of alpha globulin gene located on chromosome 16. For 2 beta, only 2 gene required. For chromosome 11, only 2 gene required. Okay. For alpha, 4 functional copies required of alpha globulin gene located on chromosome 16, and for 2 beta, only 2 gene required on chromosome 11. Okay. Now, beta thalassemia. If beta thalassemia is present, one gene mutated, beta thalassemia major, because only 2 gene required. If one is, then 50% chances gets mutated. If 2 gene mutated, then beta thalassemia major minor. Okay, so 1 gene mutated, then beta thalassemia minor 50%, 2 gene mutated, beta thalassemia major, which is Cooley's anemia 100%. And alpha thalassemia, so it is more severe. Alpha thalassemia, 1 gene mutated, no defect. 2 gene mutated, alpha thalassemia trait, patient live normal life, patient will live normal life, and that's 2 gene mutated alpha thalassemia trait, and which is called as if patient can live with the thalassemia, alpha thalassemia, and patient live a normal life, then it's, and 2 genes, his her 2 genes get mutated, then it's alpha thalassemia trait. If 3 genes get mutated, HbH disease, hepatosplenomegaly is present, means hepatitis, liver and spleen gets enlarged. And if 4 genes get mutated, hydrops fetalis, mostly fatal stillbirth. Hydrops fetalis, it is called as hydrops fetalis, it is very very severe, means stillbirth occur, the baby even can't live. Okay,